Minutes past 9 o'clock. Welcome back to Great Day for this Wednesday. And Wednesdays around here, we kind of like them because it's always a great time for a great smile.
Yay.
Dr. Steffany Mohan is here from Plaza Dental Group. And this morning we're talking about something that I know growing up everybody was nervous about.
Everybody's
going to the
still
dentist.
nervous about this.
But is it as prominent when you're an adult as it is when you're a kid?
Yes,
we're
because
talking
it
about,
sticks.
We're talking about cavities.
Yes, yeah, well, it's haha sticks. No, the great thing about this is that a lot of people think that cavities are sort of like cancer. It's something that just strikes, you know, and we don't know why, and we don't know. We know exactly why people get cavities, like exactly.
Isn't it sugar?
Yes, so there's 3 things to form a cavity.
Okay.
You need a tooth.
That'd be a start, yeah.
So if you don't have teeth, you don't get cavities, right? You need sugar. And you need bacteria. So the tooth and the bacteria are always there.
Right.
Where does the bacteria come from?
There's always bacteria in the mouth and the saliva.
So it's always there.
It's always there. I mean, we try to lessen the bacteria when we brush.
Okay.
So we're trying to get that kind of the plaque bacteria off the teeth when we brush. But the sugar is the major thing that you add. So if you have a very low carb, low sugar existence diet, then you have much less risk of cavities. And then if you brush more regularly, so it's frequency of getting that plaque off of the teeth, and then it's and floss. So a lot of people just neglect the floss, and then they wonder why they get cavities in between the teeth. We call them flossing cavities, right?
Okay.
So I mean, if you don't floss in between the teeth, you're actually missing 35% of the tooth surface.
That's a lot.
It's a lot.
35?
35%.
Now, I feel like
so in between the teeth is that there's a lot of tooth structure there that you just miss.
I've been very blessed. I need to knock on something because I'm going to probably jinx myself now with cavities that I had like one when I was a kid.
Sure.
And I haven't had to deal with it too much
Yeah.
now. But I have friends, I feel like they get them all the time. Are there some teeth or people that are more susceptible?
There are, yeah. There's definitely a genetic component. There's definitely, I mean, a lot of people, do that. So back to the frequency thing. If people sort of, if they have sugar in their coffee and they sip on it for several hours a day,
Right.
there's not a whole lot of reversing that. I mean, you really can't go backwards from that. So the frequency is so important. So if you have sugar in your coffee, drink it, brush, floss. Floss the 35%.
Floss even if you're drinking coffee?
Well, only because, I mean, if you, or like rinse really vigorously with water. I mean, make sure that sugar gets out of the mouth, gets off the teeth. Because if you don't have sugar that lives in your mouth, your risk of having cavities is very slim. So now you go to people that have had a lot of cavities,
Right.
and then they have a lot of surfaces, or what we call margins, of old fillings, old things that are more susceptible because there's an interface between the tooth and
Really?
Yeah, I've had.
it's never as good.
Those.
Yeah, it's never
Really?
as good as like the full strong tooth that God gave us.
Now,
So-
I've come into you before when I've been working on my smile, and I've had a tooth that's close to a cavity but not quite there, and you've talked about being able to protect it so it doesn't fully go that direction.
Yeah, thank goodness. I'm just at, I won't say the age, but I'm just at that age where sealants weren't an option when we were kids, and small towns.
So my wife had that done, and it's disgusting because she never, ever gets a cavity.
Sure. Well, sealants
So
can
what are
only
those?
protect the top surface of the tooth. You can't seal where that, the flossing cavities. I know I'm giving a big.
sides of the tooth?
I mean, clearly there's no, payoff for me to get people to floss, but I mean, except for the fact that we hate it. We hate when people get cavities. We hate when they have problems. We hate when they have pain and that kind of, lose a tooth and that kind of thing. So, the floss really is the kind of the magic bullet, if you will, or a sonic brush. We've talked about that before. The sonic brush at least gets a little bit more action sort of around the teeth. The other thing that people don't do is they don't brush all the way, like every spot on the tooth, every surface of the tooth. So they don't brush, like my kids complain when I brush over their gums or, like adjacent to their teeth, like, the interface of the gum and the tooth. It's a place where a lot of people miss. So they miss the, the surface right by the gum tissue. And that's a big place for cavities that people get.
We used to get those little red tablets in school. Remember, you'd show them up and show you where you didn't
spots
see.
are.
Yes.
My problem was that I thought those tasted good, so I just eat them all. And
The question I have, you said about getting the bacteria off your teeth, and then sugar's bad for your teeth. Obviously, people know that.
Right.
Now,
Well,
when you're brushing, the toothpaste that you use, is that antibacterial? Is toothpaste antibacterial, or how does that work?
Yes, it's sort of like the same thing. It's more of a cleanser than it is antibacterial. It's really, I mean, triclosan used to be in toothpaste, and it's actually sort of like an antibiotic that we don't really need. So it's, you know, when they say that hot soapy water is how you wash your hands, it's exactly the same thing with teeth. You want not hot water, but you want the toothpaste is good for cleansing, but it isn't antibacterial. It's the mechanical action of getting the plaque off of the teeth that's really important.
Because the plaque holds the bacteria there.
The plaque
basically
holds the bacteria against the teeth. It's sticky. That's what the sugar actually sticks to the bacteria.
What about using like Listerine type products?
Yeah, Listerine's really good for decreasing the bacterial count. The biggest problem with Listerine is it has alcohol in it, so it dries the mouth out, and then that actually makes your mouth more susceptible to that stuff sticking.
Got it.
So I know.
You can't win.
No, you can win. You can win. You absolutely can win. The biggest thing is, I mean, we live in a very sugar-heavy society, right? I mean, the sports drinks, the, I don't want to mention, brand names or whatever, but the sodas, oh my gosh, there's so many things with them. There's sugar.
What about the diet versions then, or the ones that don't have
So the diet
calories?
versions have acid, which makes that more, I mean, any sugar that you do take in, it makes it just that much more helpful to the environment. It makes it easier for you to get the sugar to stick and all that kind of thing. So, I mean, acid is going to dissolve. I mean, they say you put Coke on the top of your car and it'll dissolve the paint, I mean, or even Diet Coke. I mean, it's the acid is bad for you too. So.
Well, if people have more questions, of course, they can find you.
Definitely.
If they have cavities or want to prevent getting cavities, the best thing you do is go see your dentist a couple times a year, at least. But we're going to help people out by giving a Great Smile giveaway. Can you kind of explain?
We are going to give a Great Smile giveaway.
Explain for people that remember, like, what this means.
Well, it's funny. We said just before we came on, our very, very favorite thing to do is to give somebody a smile that doesn't have one or that feels like they can't smile. We hear it and we see it every day. People come in the office and every single day they say, I mean, they can't go where they want to go. They can't do what they want to do. They can't enjoy the people that they want to enjoy because they can't smile. And so we're giving away a smile. We're going to give, we have people that are sending in applications, I guess, like crazy. And so we're going to choose one and
they're going to get a smile. Coming in just a couple of weeks. What you do, just keep listening for a smile-themed song that you hear on Great Day going in or coming out of commercials. That's what you're listening for.
Right, and then you want to enter your answer at kcwi23.com, but also a photo, because we want a before, so we can definitely see the magnificent after.
It's very, very fun for us. It's a big thing that we love to do.
All right, tell everybody where your place is located.
We are in 1089 Jordan Creek Parkway. We're they're next to Culver's.
So go get your teeth cleaned and go get some custard.
Yes,
that's the idea. It's perfect. And dmsmiles.com.
dmsmiles.com.
The website, one of the best websites, period.
Thank you.
It is 9:21. We'll be right back. You're watching Great Day Live on KCWI.